place an option for it. Growing up in this area, I've seen a lot of people do a lot of not good things for regenerative medicine. And so I really want to spend a lot of time dispelling some rumors and going over the evidence that exists for regenerative medicine. And the two that we're going to talk about is PRP and stem cells. At Mayo Clinic, we were doing a lot of research on these. We sent every sample to a lab, and it was actually covered by Mayo's insurance. These are treatments that are not covered by insurance to date, but have a lot of literature, especially the ones I'm going to focus on today, and we'll go over that. So let's first just go over what these newer regenerative medicine treatments are. So first one's PRP. We take your blood in the office, we spin it down, and we get platelets. Those platelets have growth factors, and those growth factors help with healing, and they help with healing, and they help with restoring any inflammation that is in the tendon or in the joint for arthritis. Okay. And so, as you can see in this blood tube to the right, what we get is the Buffy coats, and we get 7 to 10 times the concentration of platelets. And we take these platelets that have all these healthy growth factors, and we put it back into their injured area. It's really important to note that not all PRP is the same. There has been a lot of literature trying to refine this over the past 10 years. I mean, platelet-rich plasma has been around for a decade, but the specific combination is really, really important. It needs to be 7 to 10 times the platelet concentration. You have to take these neutrophils out, and how you process the PRP is really important for having a good outcome. It's just like taking any medication. How you, the quantity of that medication and what you do for that medication is really important. So PRP has been used for many conditions now. It's used for chronic tendonitis. It's using for arthritis, muscle, and ligament injuries. And the science rationale, once again, is that these growth factors help stimulate long-term growth. And it's very safe. That's the one thing that has been well-researched and shown that its safety profile has been very safe in your own body's platelets. So what is the evidence about these treatments? The first thing I want to tell you is that platelet-rich plasma does not regrow cartilage. It has not been shown to regrow cartilage. It's not like you put this medicine in the joint and boom, your bone-on-bone knee arthritis doesn't exist anymore. But it does help with pain and function. It lasts way longer than steroids, and it is believed to prevent the degradation of arthritis. So this was a study that was done in a surgical journal, and it showed PRP. They took all the randomized controlled trials for PRP, and they showed that PRP was better than hyaluronic acid, which is the gel that sometimes people put in their knee, or saline. And it looked at patients over 1 year and showed very significant improvements in their pain, function, and quality of life. And so they took all the randomized control studies and they came out with this answer. The big question I always get is, will PRP prevent me from getting a knee replacement? So this was a study that, this was another study that showed that PRP was helpful, and they looked at randomized control studies. The next study showed that PRP versus HA, and it was another study. This was done at University of Colorado by the Orthopedics department, and showed that PRP helped with improving pain function, and showed that the specific type of PRP you use is really important. This study down here showed that PRP delayed the need for knee replacements. And it showed that one injection of PRP, 74% of the people actually delayed the need of a knee replacement by 1.5 years. And the median delay, so not the average, but the median was 5 years, and showed a survival of people that did not need a knee replacement of 85%. This is with patients with moderate to arthritis. This was a study that I just added to this presentation, just came out recently. that was published at Johns Hopkins in the Journal of Medicine, and they looked at PRP versus hyaluronic acid for knee arthritis, and they only looked at double-blind randomized control studies. So the research, everyone who had any type of opinion was blinded to make sure that no one knew what type of treatment that patient was getting. And they showed that PRP had significant advantages in improving pain, function, and quality of life compared to traditional injections.
So, Dr. Gruner, in the prior slide, you said 87.5% of people never needed, 85.7% of the patients did not even undergo a total knee replacement during the 5-year follow-up.
That's correct.
So did they ever have it, or did they just look at 5 years beyond the PRP treatment? And the reason I'm asking is because a total knee replacement is a huge deal. And if you are avoiding that for, 10 years, 5 years, that's pretty big.
Yeah. Getting long-term data is extremely hard. So I was really impressed with this study about how they got 5-year follow-up. Okay. But you're right. If the value to society is you can prevent someone from getting a knee replacement with 1 or 2 PRP injections for a decade, that really has a lot of meaningful improvement. It'll make sure they're a better outcome for the surgery. And so I think it definitely has a reliable role in medicine. And the evidence is just, there's too much evidence now for PRP for knee arthritis, just to be honest with you.
So for PRP, what is the injection rate? How many times can you have it, or how often do you have to have it to have sustaining results?
Yeah, so the way I do it is I do 1 injection with hyaluronic acid, because we had a registry at Mayo that showed that PRP plus hyaluronic acid did better than PRP alone. And that 1 injection, depending on what hyaluronic acid we use, but that 1 injection should last at least a year to a year and a half if they're a good candidate for the procedure, which is important to take into account. The severity of their arthritis is very helpful. I would say people with mild arthritis, it could last 5 years, 7 years. People with moderate to severe might be shorter than that. But it's significantly better than getting 3 steroid injections over a period of time. We know steroids are detrimental to the cartilage. And so it's a more cost-effective approach and a better approach, and it's healthier for the patient and safer. So there's been so many studies now for PRP for knee arthritis that they've taken all the level 1 randomized control studies and they're doing cost analysis. And this was a study done at Rush University in Chicago, and it showed that if PRP lasts 1 year, the cost of it to the society is $1,200. And so they're finally starting to do cost analysis studies on PRP because of the research has been so good. And so I'm excited about this as someone who's very interested in the value-based healthcare world, because I think this does have a role in medicine. So the next thing we're going to tendonitis. So tendonitis, we talked about for tennis elbow, golfer's elbow. The PRP for arthritis is not curative. Arthritis is a progressive degenerative disease. For tendonitis, it is curative. And this was a study that was done at Stanford University. It showed a double-blind, prospective, multi-center, randomized control study, and showed PRP didn't really show that much difference between no PRP at 12 weeks, but then they followed this out at 24 weeks, and they showed that PRP had a large difference in favoring. And this is traditionally how it works. You have more pain than you do at the injection because it causes inflammation, and then it gets progressively better over a sequential amount of time. It works the exact opposite of steroids. And these 2 studies showed one of them for glute tendons, so tendons on the side of your hip that people can sometimes have tendon tearing there. This was a double-blind randomized control study that was published in the American Journal of Medicine with 2-year follow-up done out of Australia, and showed excellent pain and function improvement compared to steroids, and lasted over 2 years. This was a study that was done out of Tulane University in the Department of Orthopedics, and showed that PRP was equal to surgery for medial epicondylitis, so that tendon problem on the inside of their elbow. And now there's been over 40 studies that have looked at PRP for different areas of the tendons. Some areas are good and some areas need more research, and they're not so good. So shoulder PRP has not proven out as well compared to tennis elbow and patella tendonitis. Achilles, depending on where the PRP is at. But there's been many studies that have existed now. And depending on the body, there's various outcomes that exist for patients. So we really need so just to sum up about PRP, we know it's effective for arthritis. We really know that it reliably can last about a year, depending on their severity. And for tendonitis, it's long-term, but we need more evidence for some areas.